संतोष लाल कमल फ्रॉम कान्हा। जैसा कि आप सब्जेक्ट देख रहे हैं, ए जर्नी इन हेलीकॉप्टर। आई वॉज इन द इंडियन एयरफोर्स and serving as a medical assistant. I was physiotherapist in the 14 Air Force Hospital, Hyderabad, Indian Air Force Academy, Hyderabad. In one fine morning, when I reported for the duty in the hospital, so I was given an order and given an emergency tray along with one patient named J.W. Sharma, who had heart attack. So liaison was made from Air Force Hospital, 14 Air Force Hospital. Through ambulance, I reached to the runway, Air Force Academy, and from there I was airlifted along with the J.W. Sharma, who was suffering from heart attack, where to the military hospital, Secunderabad. Patient was shifted from 14 Air Force Hospital to the military hospital, Secunderabad, by helicopter. Good evening, my dear. Good evening, good evening, good evening. Listen to the story. This is very beautiful story of Indian Air Force. So airlifted Cheeta, and in Cheeta the stretcher, and on the stretcher there was a J.W. Sharma, patient who had the heart attack. Initially he was treated there in 14 hospital, Hyderabad, and then immediately the aid was to be done, that medical help was to be done to the J.W. Sharma for his survival, for his recovery from the heart attack. So I was given the order to take him to the hospital through Cheeta helicopter, where patient has to lie on the stretcher and drip was on. So as and when he was complaining the pain, I was advised to give certain injection in the drip. That saline drip was running and that stretcher was kept like this. Both the side window of Cheeta helicopter were opened. So myself, J.W. Sharma, along with the pilot was driving the helicopter, and I was taking care of the patient. And there in the military hospital, it was informed that be ready along with the ambulance on the helipad. So within a very short period, I hope within 15 minutes, I reached safely with the efficient driving of my respected pilot of the Cheeta helicopter, and I was landed safely along with the patient on the helipad. Then from helipad I was shifted along with my patient, and through the ambulance, we reached to the hospital immediately. And there he was given streptokinase injection. Streptokinase injection, and for that I was prepaid 3,000 rupees from the hospital. Do you think the moment patient reached to the hospital, the patient was looked after by the medical specialist and staff of the military hospital? He was admitted in intensive care unit. There he was admitted, and after admission, that streptokinase injection was given, and I was asked to procure the streptokinase injection from outside. So okay, I took the ambulance along with my other staff. I went to the medical store. I brought the streptokinase injection and handed over to the intensive care unit in charge. Then helicopter was left, and then I went through the bus to the 14 Air Force Hospital, Hyderabad. This was the really risky journey, and there, because Cheeta helicopter has very less space of Indian Air Force, and I was given the duty. That is the selection of commanding officer of 14 Air Force Hospital. So I was given the duty. I have performed that duty very nicely. There was no problem. But on the air, patient used to complain, pain. So now here I will tell the use of streptokinase injection. In what are the conditions this is used? First condition, this streptokinase injection is used where the recent heart attack took place in the patient. So what happens in the heart attack? I will tell there are the two conditions. One is that is blocking of arteries. Blocking of arteries. By which? By the cholesterol. When that lumen of the arteries are thickened, that is like this, one like this. Suppose there is one tube and here wall. Then if there is a breaking of this plaque which is thickened and stick to the wall of the arteries, if that break off, so that will block the arteries. Then what will happen? The supply of oxygenated blood to the heart will stop or will be less, and then the myocardial infarction will take place. Means muscle of the heart will damage. So that's how when muscle are starting damaging of the heart muscle, then and blockage of oxygenated blood in the arteries by the that is plaque, means blood clot inside the arteries, which has taken place inside the arteries. That condition is known as atherosclerosis. That condition is known as. And when that clot is break off and blocked the arteries, then supply of oxygenated blood to the heart almost stopped, and that condition is known as heart attack. That is one reason. Second reason is twisting of arteries. When there is a twisting of arteries, of the coronary arteries especially, then supply of oxygenated blood to the heart become very less, and then also heart attacks comes. And what is the characteristic? What are the signs and symptoms of the heart attack? Second condition, twisting of arteries take place through cocaine. That substance is taken by the person for prolonged period, for a long time, so that time it takes place. And there are so many other reasons also, but normal reasons for twisting of arteries, that especially coronary arteries. There we need to break up the blood clot to regulate the oxygenated blood towards the heart. There is one condition where this streptokinase injection is used, and second condition is pulmonary embolism. When pulmonary arteries are coming to the heart, so their blood clot formation is taken place inside the pulmonary arteries. Then whatever the purification of blood has been taken into the lungs, then pulmonary arteries are when blocked, then supply of oxygenated blood again stop to the heart, and then embolism means blockage of pulmonary arteries takes place through the blood clot, and there to break down, to make the thin, means to break down the blood clot, streptokinase injection is used. Why it is used? To break down the blood clot especially. And this procedure is done especially on the supervision of medical specialist or cardiologist in the hospital. So in normal hospital it is not possible, because we have to calculate the correct dose and we have to find out the reaction also. Suppose if there is a overdose is taken place, then blood will become very thin. So that time patient may get some other effects, means adverse effect, contraindications will take place. Means for recovery we are giving, and so it may damage to the other organs and it may affect the recovery of the patient. So this streptokinase injection, administration of streptokinase injection is purely done under the medical supervision, means specialist supervision, either physician, medical specialist or cardiologist, who are well aware of the effect of the streptokinase injection. So my dear friends, this was the journey from the 14 Air Force Hospital, Hyderabad, to the military hospital, Hyderabad, through the Cheeta helicopter by me, that is Dr. Santosh Lal Kamal. I experienced this journey in the year of around 1989, when I was there in the Indian Air Force Academy. And inside the Indian Air Force Academy, there is a 14 Air Force Hospital is there. Thank you very much being with me. And to avoid heart attack, that is normally it takes place from the age of 45 years of male, means uh, men, and above 55 years of women. So to avoid heart attack, we should control our blood pressure, and we should measure our cholesterol to avoid the angina, to avoid the atherosclerosis condition. We should be away from cocaine to avoid the twisting of arteries, and we should take proper precaution and proper medication when we have some abnormal ECG, or if we have the hypertension condition. So regularly we should check up the level of cholesterol and the level of your heart condition. So be aware of the hypertension cases, and be aware of the heart attack, and be aware of the pulmonary embolism, which affect the health of cardiac, that is the heart. Thank you very much being with me. I am Dr. Santosh Lal Kamal. If you like this channel, kindly subscribe and share to your friend. Take less salt restricted diet. Take salt restricted diet. Avoid diabetes mellitus. Avoid this hypertension case, to be healthy and wealthy. So thank you. Till then, wish you a very, very healthy and prosperous life. Thank you once again to all of you.